Okay, good morning to everyone. I'd like to thank Dr. Prodigalidad and the Philippine Endourology Society for giving me the opportunity just to show you my experience in SeriousMD. Just a few disclosures. I have no financial interest in any of the products that will be mentioned in this presentation. I'm just a user of the products and I don't necessarily endorse them. However, I found them useful for my own purposes. So this is the tagline of SeriousMD. SeriousMD is a practice management app equipping you with essential tools to make your daily practice a breeze. Our app provides you with the following tools: appointment management, electronic medical records, billing, analytics, and more. So how did I get here? The EMR is something almost completely different from the way we conduct our clinics. And although I don't like to admit it, I am old enough to remember how it was before, long before computers. However, I've always been into computers since the 1980s, and the desire to go electronic was always there. However, in the past, the EMR software was immature and the technology was never up to it. The laptops then were very slow, graphics were bad, you had to scan everything, and everything was wired with big bulky cables. And if you wanted to, although there was already digital photography in 2001, 2002, these were, as you can see, this is actually my camera at the time, 3.3 megapixels, and you had to transfer them using these memory sticks. So it wasn't really practical back then. But now we have smartphones, fantastic smartphones with high quality cameras. We have user-friendly and inexpensive multi-platform end-to-end EMR apps connected via the internet with cloud storage, wireless networking with wireless printing, and of course the internet where virtually the sum knowledge of human existence is located. We also now have electronic banking, which although I remember 20 years ago, everyone was distrustful of them. However, nowadays, there's general public acceptance and proficiency in the use of all of these things. Not just the banking, not just the purchases, but the internet, the cloud storage, everything. The general public, more or less, is very knowledgeable on how to use these things, which makes the COVID crisis coming at this time quite, I'm not going to say timely, but it's a good thing it came now as compared if it had come in the 1990s or in the early 2000s. So this is my setup. This was my setup back before the COVID crisis. So even back then, I was already using my SeriousMD electronic medical record. I started last year, and I've accumulated a lot of experience and customization. That's very important. You can customize your SeriousMD experience, give them forms, etc. So in my clinic, all I have is an iPad Pro, a 10-inch iPad Pro, a wireless keyboard, an AirPrint compatible printer, and Wi-Fi. That's about it. So this is a screen which I captured from the SeriousMD website, just to give you a short introduction on what it can do. So first, you can go paperless. You can actually go completely paperless, aside from printing out your prescriptions and referral letters, medical certificates. But within your clinic, you can be paperless itself. It simplifies your practice because eventually you won't need these big filing cabinets. It takes very little time to locate patient charts. There's a lot of things which simplify your practice. You can access your patient medical records anywhere and anytime. The file storage, like I said, you don't need the big filing cabinets if you go paperless. All of your patients are on the cloud, and you can access them anywhere using any device as long as you have the internet. It's secure and confidential. I'll show you later. You can have multiple users in real time. I can have a SeriousMD app working on my laptop at the same time it's on my phone or on my iPad, and you can use it at the same time. So sometimes you want to view the chart, some results on one device while you're typing on the SOAP, and you have another device with their telemedicine. You can manage your day efficiently. It's got complete calendar functions, which you can link to your own calendars for in iOS, in Apple, or even in Outlook. It has its own updated medicine database for easy prescriptions. You make a prescription, you type the first part of the medicine, it will come out with all the different doses and even the brand names if you choose to use them. There's less reliance on the secretary or nurse, but in my experience, you still need them. But it will simplify a lot of their functions as well as your own. It's easy to manage multiple clinic locations. It doesn't matter if your patient is from hospital 1 and you're now in hospital 2 and the patient didn't happen to arrive because of traffic and now you're in hospital 2. The patient can go to hospital 2 and the chart will still be there because you're bringing the chart with you wherever you go. You know the number of patients you see every day. There's a queue and you can see all of those patients, whether you saw them or not, they are all there. And you can go back in your history and find out who you saw, when, and what time. You can also see your future patients. For example, today you open up your app, you can see how many have made their appointment for today. So you can get ready. You can even review your charts while you're having your cup of coffee. You can look at their charts and see, oh, okay, I have to take a look at these results. Oh, I have to schedule this patient, etc. And you can maximize your time and see as many patients as possible because a lot of the things that you have to do, like the paperwork, SeriousMD helps you along with it. So these are all the features. And take note, all of these features were already present before the COVID crisis, and I've been using ever since then. But now, you now have telemedicine, also known, according to their terminology, virtual consultation. And they added this just in time for the COVID crisis. So again, this is my setup. iPad Pro, keyboard, AirPrint compatible printer. That's wireless. Take note, the printer is wireless, and Wi-Fi. With telemed, this is now my setup. I don't need the printer anymore. So I still have my phone beside me because this is my own preference. The video consult is through my phone. On the iPad, what I have is my EMR. So while I'm talking to my phone, the patient on my phone, I can now access my EMR, look at the previous data, look at results, and type in my own updates. So what are the pros? Now, I'm not going to go through all the pros of SeriousMD because there are a lot. But I will talk about the unique pros, which are probably not present in a lot of other options that you use. The first pro, it's a fully Filipino-owned company. So how does that actually affect us? But for one thing, a fully Filipino-owned company will follow Philippine law. If there are updates to Philippine law, they will comply. PhilHealth, DOH, they will comply with all of that. It's cloud-based, completely cloud-based. However, in your iOS app, the database is every time you turn it on, it updates your database. So even if you lose your internet, as long as your device had just recently updated its database, all your patients, all the data is still there. So it's not like maybe other solutions wherein you lose the internet and you lose power, so you lose all of the connectivity. Your data is still in your phone. So you can suddenly just call them on landline and just talk to them and still use your EMR. It's fully compliant with the Data Privacy Act of 2012 and even US HIPAA. So a lot of other solutions, because they are not Philippine-based, they're actually based abroad with a Philippine distributor. So they are HIPAA approved. Here, this one is specifically compliant with the Data Privacy Act of 2012. If you remember, some months ago, there was a lot of requirements by the DPC, some documentation on your records. If you had SeriousMD back then, SeriousMD themselves will help you accomplish these requirements. It's got a fully functional EMR or electronic medical record. So it is completely functional. You can choose what data to put there. If you don't need that much data, you just need just the symptoms, just the chief complaint, then diagnosis in your plan, you can use it as such. But if you want something completely detailed, you can also do that. Incidentally, this is not just for outpatient. You can actually manage your inpatients. while using SeriousMD. And in fact, that's what I do. I have, when I have inpatients, there's another column in my dashboard which shows me the inpatients I have in each particular hospital. And I showed you, I use it on an iPad, so it doesn't strictly need a laptop. So you don't need to purchase a PC or a laptop for each clinic or lug around your laptop everywhere you go. I just lug around my 10-inch 10-inch iPad. I've got the wireless keyboards in all clinics, which is relatively cheap. You can buy a lot of these keyboards. And the printer which I'm using, it's a wireless printer, AirPrint compatible printer. It's relatively cheap. It's not even 5,000 pesos. You can create templates for common paperwork. There are existing templates already, generic ones for medical certificates, clinical abstracts, referral letters, treatment protocols, and prescriptions. It's already there, but if you want to make it really customized with your tagline on top, with your clinic hours, with your specialties, you can also do that and just submit this data to SeriousMD and they'll create it for you, surprisingly fast. Telemedicine, it's got telemedicine with video built into the app itself. You don't need to use another app to make it work. Scanning, sending, and receiving a document and photos, you can do it in app. For example, the patient is doing telemedicine with you with the Now Serving app. That's their app. So they've got these results, but they weren't able to scan it before the consult. They can scan it right then and there. Take a picture, then you'll see it on your screen coming out in real time. At the same way, if you want to send them prescriptions or certificates, you can make them real time and send them real time. You'll see it. And they can open it for you and you ask them, oh, did you receive the PDF? Yes, doc, I saw it. So instant confirmation. You can even download the certificates that you've made. So in case they're not able to read it, you can send them through a different means like Facebook Messenger or even Viber. So while you're doing these documents, all the scans that the patient sends you are automatically saved in the patient's record in your EMR. So after the consult, you want to take a look at the patient's results again, it's already there. You don't need to copy or paste it from your email or from Facebook Messenger. If they use the SeriousMD app, it's already there in your EMR. It's got built-in billing management and online collection via credit or debit cards. They also support PayMaya. GCash, they say, is coming soon. And this is for both telemedicine and conventional clinic. So if your clinic doesn't have credit card validation or doesn't have GCash or PayMaya, and you're using your SeriousMD EMR, you can teach your secretary how to get their payments through the payment module of SeriousMD itself. You don't need to apply for a connection with your bank for credit card transactions. It has a built-in SMS messaging facility without using your personal phone number. So let's give a little thought on SMS. A lot of others have chats, but the chat, you have to use the app to read the chat. With SeriousMD, it is truly SMS, so text message. So the patients receive a message from you via their text message app, so built in. So it's much easier to contact your patients since they don't have to look at Facebook Messenger, they don't have to look at Viber, they will receive it in their text. You can use the EMR even in a conventional clinic. As I said, I've been using it before the COVID crisis. You can use it during the COVID crisis, and you can use it after the COVID crisis. If you're able to customize it, you'll be able to use it for your conventional clinic. And believe me, if you put some time and work into it, it'll make things very easy for you. You can register sub-user accounts for medical secretaries and nurses. So you can grant your secretary, or if you have a nurse assistant in your clinic, you can grant them access to your EMR, and you can set permissions. So your secretary, you can put your secretary just to access your appointments. But if you really trust your secretary and there's a need in your particular case, you can have them access the patient's medical records if you want. But you can disable them also if you want. So everything is customizable. And I think this is one of the most important things that SeriousMD has shown me, and it's quite unique in the Philippine industry. Their support is extremely helpful and responsive. I can't overemphasize this. You have problems, you send a chat, they will respond as soon as possible. If it's an emergency, you can even talk to them. So you can do one-on-one demos with interested doctors. These are scheduled, especially nowadays, there are a lot of new users coming in. So they can schedule a one-on-one demo. Nowadays, it's via video chat. But last year, they really go to your clinic and show you how they do it, one-on-one, face-to-face. Now, because of COVID, video chat na lang. There's online support via chat inside the app. They're very responsive. They usually reply within 1 hour, sometimes even earlier. Just so happens one of their support staff sees your question, they will immediately answer. They have regular webcams for new and veteran users. We've been having a lot of webcams previously, and all of these have been stored and can be accessed by registered users, even those with free accounts. And whatever you request will be entertained. They will listen to you. However, that is only if the technology is capable. I mean, I myself have made requests and it turns out, okay, that's not really feasible at this time. So they're very open-minded and they will listen to you. And I think that is extremely important. And in fact, in Dr. Castillo's previous presentation, what have you? You want to have security, you have to have usability, and you have to have customer service. For me, all three of these things have been fulfilled by SeriousMD. So, how do patients get into my telemed clinic? Old patients, new patients, how do they get into it? Well, when you make your SeriousMD account, you're given a custom link. So the custom link, mine is like this. It's seriousmd.com/doc. Then you can specify what your username should be. I just use DRYUSI for Dr. UC. So if you type this in your browser, they will go straight to my clinic, my telemedicine screen, and they can book their appointment on that screen. But the question is, how do you get your link to your patients? If they don't know your link, then what's your if they don't know about your telemedicine clinic, what's the use? So you should have a way to get the link to your patients. You can do mass SMS, texting, or email to your patients. Now that would be nice if you had an EMR previously. It was easy for me because I had my EMR since last year. So all I did, I asked SeriousMD to do a bulk SMS to all of my existing patients, and they did that. And patients replied to the SMS saying, got it, doc. Oh, thank you, doc. They can see that. But if you didn't have an EMR solution before, well, the next thing you can do is just pull out all your charts and have your secretary text each and every one of your patients. Now, depending on the on the number of patients you want to text, I'm not sure if that's practical. Hospital-based. Each of the hospitals nowadays are very active in setting up their own telemedicine or asking the doctors to set up their telemedicine. But the hospitals are very willing to direct your patient. So if a patient calls your hospital, the trunk line, and they want to see you, and they tell you, oh, he's not holding clinic unless it's telemedicine, you can give your link to your hospital's operator information so they can relay that link to your patient and thus get into your telemed. Social media. You can create a Facebook page. Take note, a Facebook page, this is not your Facebook profile. This is your personal page for friends and relatives. That's your profile. Your page is your professional presence. You don't reveal your personal cell phone, your personal address, or you don't put up your family pictures on your Facebook page. This is completely for your telemedicine, or not even telemedicine, your regular clinic. For example, this is my Facebook profile for friends, relatives, etc. But this is my Facebook page. See, so your Facebook page has to be professional. It just focuses on your career as a doctor and not on your personal interests. So this is the gateway page into your telemedicine console. So if you type the customized link, this is where you go to. So as you can see, you can do. There's some form of curriculum vitae here. Then all the patient has to do is click on book appointment. When this comes out, this is the next screen. So they choose between I'm an existing patient or I'm a new patient. After that, this is what comes out. So it shows you it shows you the kinds of clinics that you have. For now, it only shows virtual urology clinic but once you start your regular clinics, you can have multiple clinics here. So they can choose which hospital to go to, or they can actually choose a virtual urology, a virtual clinic. After that, they will have to check on the I have read, understood, and accepted the terms and conditions. If you click the terms and conditions, this is where the medical legal aspects go into. The such and such telemedicine cannot replace a physical exam, etc., etc. So they have to click this. Preferably, they have to read the terms and conditions. So if they click this, the next will be this. So they just enter the patient details, etc., etc. Then they submit it. Okay. Once you submit, eventually you will open your dashboard. So this is my dashboard. So this is what you will see in your app or in your laptop. Take note. There's this notification up there in the calendar. That means there's someone who has requested for an appointment. You can see the red badge. So if there's a badge there, someone is requesting for an appointment. You click on this, so this will come out. This is a sample patient. Okay, so this will come out. So you click confirm. You check out the date. If the date is okay with you, you click on confirm. This will now come out. So just put the data. If it's a new patient, the reason for visit, there are lots of choices there. New patient, follow-up, post-op, whatever. That's customizable. So just fill out the data, include the time. Then once everything is okay, make sure virtual consultation is checked so that it is a virtual. If it's not a virtual, it's an actual clinic. After the ECQ, you can turn that off. Then click on save. Once you click on save, this screen, this is what your patient will get. They will receive an SMS, okay, through SMS, not email, not Viber, not Facebook Messenger, a true-blooded SMS. So as you can see here, download the app for updates. So you just click on this link, and you will go straight to the iOS App Store. And you can now download the patient app. So this will come out, as you can see here down below, the Now Serving app by SeriousMD. This is your patient app. The one on top is the doctor's app. So when they click on this, on the download, they can now download the app. After the download, after all of this, what you will see now in your dashboard, you will see the patient who you just approved the consultation, the appointment. You will see them now in this database, in your dashboard for this date. When you click on that, the EMR will now open up. So this is what's inside the EMR. So like I said, it's a sample patient, so I'm not violating any data privacy rules in this case. So you can prepare, if let's say you've been chatting with your patient through Messenger or whatever, you can put some data in there already to shorten things, to make things simpler later. So when you click on the plus sign, you can now start a new record. Once you're ready, if you click on the ellipses, the 3 ellipses, when you click that, this will now come out, this pull-down menu. As you can see, there are a lot of functions here, but what we're interested in is in the start virtual consultation. So this is assuming at this time, this is the time that you agreed on with the patient, so you can now start the virtual consultation. So when you click that, this will now come out. So if you're ready, you can now start the call. When you click start the call, this is what will come out in the patient. The patient will receive a text telling them that the doctor is calling them. Once they tap on the link in the text, the Now Serving app will now fire up, and this is the first thing that will come out. Consent required. So if they click on View Acknowledgement, this is what they will have to read, and they have to click I accept in order to start the consultation. So here are all the medical legal aspects which the patient has to agree upon. So every time you make your consultation, they will always have to do this. So hopefully this is enough legal protection for the doctor. So this is the screen that the patient will see after accepting. So this will now show you, on the left side is what you will see, and on the right side was what the patient will see. So this was taken simultaneously. So you can now see the patient here. Patient now can see you. He can see himself. So this is the time when you can start doing the consultation. So you do the consultation, and afterwards, let's say you want to give the patient a prescription. So if you look at this, this is the prescription which I made for this patient. So I'm giving a couple of medicines. So once you complete that using the SeriousMD, you don't need to write it down or take a picture of it and send it to the patient. The app will do it for you, and it has a built-in pharmacy, a built-in MIMS if you like. So once you complete the prescription, saved it, you click on the ellipses and you will see this pull-down menu. And you just click on Share to Patient. Once you click on Share to Patient, this is what the patient will see. As you can see, there is this file attached to the chat in the patient's app. When you click on that, they will see this image. So that is now the paper prescription, an image of the paper prescription. The patient can print this out, and legally now the patient can just show the prescription to the pharmacy, to the pharmacist, and they will now fill the prescription. Incidentally, you can print this out. This is exactly what it will look like when you print it out on a wireless printer. So you can have your signature built in. In the past, I didn't have it. I had to sign each and every print. You can have your customize your patient information up there. I have QR codes. Those are my clinics. So it's up to you on what you want to do with that. You can also print medical certificates for certain corporations with deals with your hospital, like BSP with NKTI. We are neighbors after all. You can have these customized form. I sent this form to SeriousMD and they recreated it here. If I fill this out with the SeriousMD will put the name there, even the diagnosis, everything. Even your signature, if you choose to do so, and just print it out and give it to your patient back in the past, or you can have it sent electronically. The customization of forms is really elaborate. You can give them really elaborate forms. Like for example, this is a new one, the COVID-19 screening list of NKTI. I sent them this, and you can now check this online. And when you print it out, the name of the patient, all of your markings here will all come out, printed out. So, for example, you now finish the consultation. Okay, everything's done. Patient is now offline. What's next? This is one of the most important parts. See that icon? That is your billing icon. So when you click on that, this screen will come out. So you can now bill your patient. So you have to set up some services. Ano ba yung mga products na binibenta mo, kumbaga. So first consultation, follow-up, medical certificate issuance, virtual consultation, emergency. So all of these may have different rates. So I just chose the virtual consultation. It comes out here. So this is now my charge slip. And you can now choose to just save the bill, save and settle. For example, if they already paid you physically, or for the telemed, you just click on save and send pay link. So it will now send the pay link electronically to the patient. So they will receive a text or an email, and when they click on the link, this will come out in their phone. So they can pay with this. This person chose PayMaya, so this is what they will see, and this is what will come out. And they click on settle bill, and they will receive this payment successful. This is Leapfrogger. Now Leapfrogger is the parent company of SeriousMD, so don't worry about that. That is the parent company, so that's legal. So once this is done, you will now receive a notification that the patient has actually paid. If they use this payment link, it will automatically reflect on SeriousMD. Lalabas dun sa billing database na bayad na yung pasyente, settled already. So you can see in your patient database, in your billing database, which patients have settled, which patients have not. Now, frequently, patients who have not settled, they may have not received the link because they made a mistake in sending the number of the cell phone. You can send the link through different means like Viber, Facebook Messenger, or whatever. Because honestly, a significant number of patients, they don't receive the link. Maybe because error in the cell phone or the email address, they gave the cell phone of a relative or whatever. So SeriousMD's payment facility supports credit, debit cards, and PayMaya. GCash will be available soon. Personally, I have my own PayMaya and GCash account for this purpose because patients may really not be able to use the link. So, but I put it in a different cell phone number than what I use for my personal. Bank transfers are available by request. So, but you don't want to use your main bank account. So you may want to have multiple bank accounts in different banks. So the patient may have BDO, patient may have Betro. So if you're able to have different accounts, then what's well and good. The patients have more options. SeriousMD, the ones who use a SeriousMD billing, they will remit to a bank account which you submitted to them every week if your accumulated remittances total 2,500 pesos or more. So it's not daily, it's every week. But if you didn't have any consults for this week, or you only had few consults and it didn't hit 2,500, they will not remit yet. Only when it gets to 2,500 pesos or more will they remit once a week, usually Fridays. Incidentally, SeriousMD charges a service fee on top of your consultation fee. So if you're asking for this fee, they will put a service fee on top of that. The formula is 5% of that bill plus 50 pesos. I think that's reasonable enough. I've talked about the pros. Let's talk about the cons. Now, one con is it has a steeper learning curve. Honestly, it's not as easy to get into immediately as compared to other options. However, remember, this is a full-featured EMR. There are other options which offer only telemedicine consultation, the video, and you need to use a paper chart beside you. So you have to keep physical records pa. But if you want to use the EMR, then definitely it has a steeper learning curve. However, I understand not all doctors need the EMR features, but the basic telemedicine may be sufficient for them, but this is also usable. It does have a monthly fee, which will be charged to you, to the doctor. The fee is 1,950 per month, but this is for unlimited patients and cloud storage. So you don't have to worry if you have 2,000 patients, 5,000, 10,000 patients with their records digitized, records inside the database. You will still pay for 1,950 per month, which honestly, I don't think is that expensive. I mean, what percentage of one clinic day is that for you? Now, another con is there's no dedicated Android app at this time, but Android phones or tablets may use the web app via the Android Chrome app. It has near equivalent capabilities. Bakit walang Android app? Because in the older Android versions, there were security issues which would make the app not compliant with the Data Privacy Act or even HIPAA. However, they are committed to coming out with an Android app once the inherent insecurities of Android have been fixed. They say it may have been fixed now already, so they will probably be working on that Android app. So, what are my end notes? Well, you have to pay for it every month, unlike others which offer free to the doctors and just tag on a service charge that your patient pays. However, you get what you pay for. A lot of them may not have any EMR features, no custom forms. They can do e-prescriptions, but you can't customize it, etc., etc. So honestly, you get what you pay for. If you pay for SeriousMD, you will get all the functionality which I mentioned, and even more because they are adding the functionalities quite regularly. If you see their support announcements, you will see the features coming out almost every week. You also get what you work for. If you're willing to put the time in configuring your SeriousMD, making the templates, customizing everything, and sitting down and during your consult, inputting the information, make proper diagnosis. You can even use the ICD-10 if you want for research purposes or whatever. You get what you work for. If you work for it, you're going to get a lot of advantages and a lot of features. Benefits of the SeriousMD. EMR will definitely be useful at the end of the crisis in a conventional clinic setting. If you weren't into the EMR before the COVID crisis and you start going to the EMR now, you may be surprised how easy it is actually. It's just a bit tedious at the start, but once you get it going, once you customize it, once you have your favorite medicines in there, your templates for certificates, referrals, the list of the doctors you refer to, everything will be easier. Now, for those who in the audience who have been practicing for a relatively few years, it's easy because you don't have that many patients yet. So getting into an EMR now is is highly recommended for you. What about for the more senior clinicians? Unfortunately, I'm included in that. Now, what I did, there are workflows that you can establish so that your old patients' paper charts can be gradually incorporated in the EMR. Essentially, what I do, I just take pictures of the old charts as they come in. So if a patient comes in, old chart, after the consult, I take picture of the old chart and upload it into their EMR. So that's it. So eventually, after a few months or so, pakunti na yung old patients, especially the old patients with really thick charts. Once all of these patients come in and you're able to scan the thick charts, everything will be a lot easier. Patients really love the convenience. When I print out the prescription with all of the customization, with no ugly penmanship, my penmanship is really the worst. So they are so happy. The prescription, the certificates that you give them look very professional. They're customized, and they show my QR code. They show my clinics. They can show it to their friends. Oh, look at my prescription from my doctor. It's very professional. Oh, who's your doctor? Oh, here you can see him if you want. So it's also quite a good marketing tool. The professionalized documentation that you give to your patients really impresses them. So that was my last slide. So again, I'd like to thank the society for giving this opportunity. And honestly, I hope everyone can try out SeriousMD. And I truly recommend that you explore all of the extensive features that SMD has to offer.